So today we'd like to welcome to the Nutshell Michael Metoudi. Michael is a registered dietitian and research scientist. He holds a master's in molecular medicine and a master's in clinical nutrition and dietetics, and found his way to the evidence for plant-based diets whilst working in clinical trials for immunotherapy-related cancer treatments at King's College in London. Michael now works in Dublin in nutrition research, as well as in the clinic with clients of all ages, and his particular interests lie in nutrition, in its role in cancer, immune system, and eating disorders. So welcome to The Nutshell, Michael.
Hi, Bo. Thank you so much for having me on. It's such a pleasure to be here.
Brilliant. We've been looking forward to this one. Can we just start with, we'd love to know a little bit about you and where your interest in food came from.
So I suppose my interest in food started around, now the best part of 10 years, and it really came about after watching quite several documentaries related to nutrition and health. There appeared to be, an explosion at that time, around a decade ago, on documentaries focused on nutrition aspects of plant-based diets and health, the likes of Forks Over Knives, and even that documentary by Dan Buettner's documentary related to the blue zones, which I just found quite fascinating. I suppose in retrospect, there may have not been all sort of reputable at the time, and maybe not as grounded in high quality evidence, but I suppose nevertheless, it really did spearhead me into delving deeper into the science of when it comes to plant-based nutrition and health. And I suppose following on from that, I learned that how such a profound effect food has on food choices, on the environment, and of course the ethics now surrounding animal welfare. And that sort of came a little bit later in terms of the triad. But I suppose the more I learned, the more I realized that food really does have one of the most profound effects on our health, and it really is a tool in shaping our health, both in a positive and negative way. You know, you look at the likes of the study of the global burden of disease study back in 2017, and they really showed that, dietary patterns can be one of the leading causes of premature deaths. I believe it's something like 11 million deaths are attributed to poor diets globally, which I just found absolutely staggering. And it's incredible to think that something as simple as, daily food choices, what we have 3 times a day, can really govern our health and many aspects of our health as well. But I suppose I really am inspired by so many, medical professionals of the plant-based space. People like, Neil Bernard from the Physicians Committee of Responsible Medicine, and incredible clinical research that they're currently doing. One of my biggest fans, I suppose, is someone you had on the show just recently, Brenda Davis, which I really have to say, she really absolutely influenced me in my decision and my choice to become a dietitian in the plant space.
Were you already a dietitian and then you became a plant-based dietitian, or how did that journey happen for you?
I've been plant-based for the best part of 10 years, working in the space of cancer research. So I suppose my journey really to become a plant-based dietitian was very much influenced by my previous career in cancer research. So I used to work in that field, as you sort of had mentioned there, Daisy, on clinical trials when it came to particular types of cancer, head and neck cancer. And so I worked within Guy's Hospital in collaboration with King College, which really focused on developing, I suppose, like a cutting edge therapy at the time referred to immunotherapy. It's actually received quite a lot of notoriety. And even the leader of the field has now received a Nobel Prize for it. So it really is a fantastic kind of therapy now. What I found and I sort of became exposed to was the patients that we had been seeing developed conditions, for example, cancer cachexia, which, as you probably know, is a really severe condition related to, unintentional weight loss. And I really saw a lot of them receiving incredible treatment from really amazing dietitians specializing in oncology and cancer care, which really they tailored the nutrition intervention to help improve the patient's sort of strength, overall quality of life. And that really spearheaded me into wanting to pursue a career more in the dietetic space. So that's where I sort of came back to Ireland. I did a master's in clinical nutrition and sort of became a dietitian since then. And so I don't normally, formally work as a dietitian specializing in plant-based nutrition. As I said, I kind of work more in the eating disorder space, but I do ad hoc consultations when it comes to individuals who require, nutrition and are very interested in plant-based.
Brilliant. Fantastic. We need more people like you, don't we, Michael? From that, what sounds like very scientific sort of dietitian observations there, you're now working for PBHP, and you've recently published more qualitative research exploring the knowledge and beliefs regarding whole food plant-based diets amongst dietitians. And This sounds fascinating to me, but I want to know more about how you specifically identified this as an area that needed research.
It really was an area to explore simply because there was just no research out there. It was a complete unknown. We did identify some research into dietitians' perspective towards sort of plant-based diets and sustainable dietary habits, particularly within the US, Australia, and I believe South Africa on their perspectives. But really, there was absolutely nothing when it came to dietitians' perspectives within the UK and Ireland and whether they're sort of implementing plant-based diets into their practice. And I felt this is quite surprising to me, considering the efforts and the policy shifts, particularly within the UK and dietetic institutions promoting, food sustainability, plant-based diets and healthcare. But there really indeed was a sort of a clear gap in the literature, and we wanted to really assess whether dietitians were actually integrating plant-based dietary advice into their recommendations. There has been a fair amount of research looking at, I suppose, medical doctors, physicians, and their perspectives on plant-based diets. Less is known when it comes to actual registered dietitians. And really, this was surprising given that, dietitians are really supposed to be the forefront of nutrition guidance, almost shaping public health and nutrition. It seems like that, they've been kind of largely overlooked. So, this really was an area of exploration that we wanted to delve deeper, particularly within the UK and Ireland as well.
So you mentioned there about the positions. Maybe we can take a step back and you just tell us a bit about what the formal positions are of the UK and Ireland professional bodies when it comes to dietitian guidelines. What are their formal positions on whole food plant-based diets at the moment?
Both the British Dietetics Association, the BDA, as well as the Irish Nutrition and Dietetics Institute, INDI, they both acknowledge that planned plant-based diets are essentially nutritionally adequate and they're really beneficial for, I suppose, all stages of the life cycle. So this is going from infancy all the way up to older adults, which is really fantastic, and it's incredible breakthrough. So they both emphasize the importance of including really a diverse range of plant-based foods, things like whole grains, beans, nuts, seeds, fruits and vegetables to really ensure nutritional adequacy. So it was really fantastic. And we know that the BDA have also written additional guidance on sustainability from their One Blue Dot, which was really a sort of a template or benchmark to really help advocate dietitians on implementing sustainable dietary advice with their patients as well. So that's sort of one step further. So I'd like to say that Ireland is on the same sort of level, but the UK is certainly a little bit more ahead when it comes to sort of sustainability and implementing that into their practice.
You decided to study dietitians that were working in Ireland and in the UK, possibly working under slightly different guidelines, you're saying. So what was the study that you actually came up with?
It was a collaboration with MinutriWeb. So I'm sure some of you have heard of this platform. It's run by sort of Tanya Hafner, and we were very fortunate to have that collaboration with her and her platform as well. So we really specifically chose 3 areas or pillars on the perspectives of dietitians in the UK and Ireland and the role of plant-based diets in clinical practice. As you know, there really isn't a consensus definition of what constitutes a plant-based diet per se. So we really decided to use one particular definition. We went with the Eat Lancet planetary health diet to understand that was the definition. So there wasn't any ambiguity of what really was a plant-based diet, which it really constitutes around, I believe, 87% of total energy coming from plant-based sources. It came out of the work by Professor Walter Willett from the Harvard School of Public Health, who really, back in 2019, wrote that report on the Eat Lancet Commission, trying to synonymize both health and sustainability together as part of the development goals of future food sustainability. So as I said, those 3 facets or aspects that we really wanted to look into was essentially the knowledge base of dietitians. So what is their knowledge on the suitability of plant-based diets, particularly throughout all the stages of life, from infancy to adolescence, adults and older adults. Also, I suppose we wanted to assess what their understanding was in terms of key micronutrients of concerns when it came to individuals adopting a plant-based diet, as well as their knowledge on the role of plant-based diets on preventing, non-communicable lifestyle-related diseases like cardiovascular disease, diabetes, and even some forms of cancer. The second aspect that we wanted to look at was essentially their beliefs. So what were the opinions of dietitians, their own professional experience on implementing or not implementing plant-based diets in clinical practice. So we used what we call a qualitative approach. So we looked at themes from individuals. So we had sort of open text box responses from dietitians so that they were able to type in and express exactly what they felt, what perhaps were the barriers, what were the struggles, what were their opinions in general. And then we sort of kind of collate that into what we call themes or thematic analysis. We look at certain patterns and themes in the data and come out with a collated version of this. Arguably, most importantly, we looked at the barriers. So what were key barriers that perhaps dietitians in the UK and Ireland had when attempting or trying to implement plant-based diets into their clinical practice? For example, was there enough education? Did they receive enough education in the university setting? Do they have confidence in implementing plant-based diets? And is there any resistance within the workplace if they have enough support? So we really want to look at all of those aspects and really try and come up with a consensus of what kind of work we need to do in the future to really support dietitians in the UK and Ireland at implementing plant-based diets in general. We designed a sort of a cross-sectional questionnaire that we distributed to both UK dietitians and Irish dietitians, and we used the My NutriWeb platform, and we also distributed it amongst the INDI platform as well for Irish dietitians.
It sounds like it was quite a lot of work for them filling that in. You know, when you're doing a response and you're doing the free text boxes, but you got a lot of responses, did you? And we're hoping you can say something more about what were the results you got.
Sure, it was a fantastic response, really. We had around, I believe, 335 dietitians. 52 were from Ireland, the rest were from the UK. And when it came to that open text box responses, around 40% responded with incredible long reams of words that they sort of wanted to express, which was really incredible trying to analyse that. And it did take some time, but it was absolutely worth doing. When it came to the results, you could say it was almost like a spaghetti western effect where you have sort of the good results, the bad results. I won't say the ugly results, but I will say perhaps the surprising results. We'll start with the good results. So from the research, we know that the majority of dietitians in the UK, around 3/4 or 75% of UK and Irish dietitians, actually agree that a well plant-based diet is really suitable for all stages of life, and they are willing to advocate this advice within the workplace. And they do feel that it really should be an integrated dietary choice into hospitals as part of, I suppose, the standard care. So, that was really fantastic to see that. However, there were certain barriers. So I suppose into the bad news, or uncovering a little bit deeper, there did appear to be some knowledge gaps when it came to their understanding of plant-based diets. One of which was significant was certain micronutrients of concern. Things like iron came up a lot, the increased risk of malnutrition, and one quite concerning one was, I suppose, and a little bit less, the risk of acquiring an eating disorder when following a plant-based diet. Dietitians really felt that they had a lack of support if they were to advocate for plant-based diets in the workplace. So around a third really did feel supported if they were to advocate for a plant-based diet. So the majority really didn't feel supported. There really seemed to be a lack of education, both within the university setting. So around 20% of dietitians really felt that there was enough education on plant-based nutrition when studying at a university level. 20% actually said that there was no education received in university, and around half actually find that there's not enough education out there currently to implement plant-based diets as part of their dietetic care with their patients. So there really is a lot of room there for helping improve education.
That's really interesting. And as you're talking about that, I'm thinking about how there's probably within the training, there's a lot of scope there for dietitians to be thinking, I need to support the patient in whatever diet they want to do. But they themselves may be thinking, but I wouldn't want to do this diet. Coming on from that, we know from other areas of healthcare that if certain behaviours are not followed by a health practitioner, if it's not their choice to do something, they are much less likely to bring up that particular behaviour with their patients. So I wondered, can you say anything about how keen dietitians are to embrace the benefits of a whole food plant-based diet or a healthy diet generally? And within that, how keen they are on following a sustainable diet.
Sure, and you're absolutely right. I've kind of looked a little bit into this research that shows that healthcare professionals who really engage in behaviours themselves, lifestyle behaviours, are more likely to counsel patients in similar practices. And I believe there was a study last year done from the American College of Cardiology looking at nurse practitioners who essentially maintained, their healthy lifestyle habits, and that their patients were, I suppose, twice as likely, I believe, were likely to follow the advice given by the nurses if they themselves practice those behaviours. And we see this, I suppose, all the time in medical school curriculum. There have been some studies showing integrated seminars on plant-based nutrition and sustainability, and improves their overall knowledge scores and actually improves their overall health, which I thought was quite fascinating as well. I don't believe, to my knowledge, there's been that many formal studies on, looking at actual dietitians' personal dietary habits and how that impacts the behaviours of their patients and following, particularly in the context of plant-based diets. When it came to our results, looking at the results of our paper, around 65% of dietitians, I believe, actually personally attempted or tried to transition to a more plant-based dietary pattern. So there are indeed open to it in adopting a more sustainable dietary pattern. One of the biggest obstacles that we saw in the results of our paper were excluding certain foods. Things that came up were most likely to exclude were, I suppose, dairy and eggs. That seems to be the most, barrier for them to transition to a more plant-based or sustainable dietary pattern. It does suggest that dietitians are committed at promoting health and sustainability, but it seems perhaps their personal preferences, or whether that could be concerns over risk of micronutrient deficiencies, really does pose some sort of kind of barrier in transitioning themselves to a plant-based diet, and whether that has a knock-on effect to their patients. Most certainly we see it in other literature of other medical professionals, so I suppose why not would it be when it comes to dietitians themselves?
Yeah, and I think that ties together, thinking about a couple of podcast episodes that we've done recently where we had our guest on, Neil Rutherford, who talked about having an NHS dietitian for weight loss, and the first couple of them being people that just couldn't consider a plant-based diet, which he wanted to follow. And then the third dietitian being a vegetarian, and then obviously being more supportive and open of it. Coming back to then when we spoke to Brenda Davies on the podcast recently, she expressed a lot of sadness about dietitian beliefs that plant protein is an incomplete protein. Given that, dietitians have got a curriculum and they're trained on these things, where are these beliefs still coming from, do you think?
Yeah, I mean, I found that quite fascinating as well. So our actual research also showed that was, I suppose, the most surprising of all the results when it came to dietitians' knowledge on this concept of plant proteins being incomplete. We know that this is a very much outdated concept, spanning from, best part of half a decade, from the 1970s. It was popularized by sort of an author from the States. I believe her name was Frances Lapay, who really, in her book, wrote for Diets for a Small Planet. So she really suggested that plant-based diets really, are lacking in sort of protein quality, that they need to be, I suppose, paired. So what does this really mean? It means that plant-based proteins don't contain all of our 9 essential amino acids. Later on, she did recant and revise her stance, acknowledging that really this concept was overly rigid and not grounded much in a sort of scientific evidence and understanding of protein metabolism. The latest evidence now really refutes this myth. So, we know research on plant foods contain all 9 essential amino acids, and they don't necessarily need to be paired to, obtain optimum protein requirements. This has really come from a lot of research by, you may have heard of Christopher Gardner from Stanford University, who's really done extensive research on this as well, looking at the fact that the body actually does maintain a pool of amino acids, and that really allows for sufficient protein synthesis over the course of the day. So if we do meet all our energy and protein requirements, it really isn't a problem, and it's not necessary to pair plant-based proteins such as rice and beans together when we're getting sufficient energy and protein throughout the day. And I suppose what I found most fascinating, and kind of more looked into this, it's interesting because there does seem to be concerns not only about this protein pairing myth, but also the fact that there is a concern that plant proteins don't help with muscle growth and muscle strength. There seems to be a kind of an understanding that there's an inferiority of plant-based proteins in maintaining our muscle mass and muscle protein strength. And I've even sort of looked at a recent systematic review, even that was just published last week, which is essentially a pooled review of a cohort of different studies that are pooled together. So it's sort of a higher quality level of evidence. And they really actually compared plant-based protein to animal-based protein. And the researchers found that plant-based protein had really similar effects in terms of muscle performance, muscle strength, and there was no greater risk in reduced muscle mass compared from plant-based proteins to animal-based proteins, which was really, really fascinating. And we don't really know why the fact that dietitians in the UK and Ireland are still, I suppose, believing this myth. And it was puzzling because when we actually looked deeper into the data, we, I suppose, stratified for age of our dietitians and maybe hypothesized that it could be the older generation of dietitians that might have had these beliefs because of outdated curriculum. But when we did stratify for age, we could actually see there was no difference in the younger cohort of dietitians as well as the older cohort. So, we can't say that it's just outdated dietetic manuals. And I even gone back and looked at the British dietetic manual, in the UK, and it really does discuss about how plant proteins are adequate and the protein pairing is not necessary. So it really is a bit of a head scratcher, kind of puzzled as to why the beliefs are still out there, and it's something that we probably need to explore a little bit more, because it does seem to be perhaps a perpetuated belief that's still going on even to this date.
That's so interesting. And I must confess here that I've got Frances Lepay's book, and you can tell I haven't read it because I didn't know that she'd said that thing about pairing proteins and the inadequacies. So maybe I'll put that to one side now and not feel bad that I haven't got onto reading that. What you're saying about protein, though, it's very interesting, because I would have thought the age thing was what would make a difference in terms of the curriculum. That sounds like that was a really good hypothesis to have. But sometimes I wonder whether it's a bit like the goalposts have moved. So whereas before people used to be happy sort of aiming for, somewhere between 50 and 70 grams of protein a day. And now young people seem to be very intent at times on eating 50 grams of protein in a meal. Could that be what's influencing the younger people?
Yeah, absolutely. And it is something more of a research area that we need to kind of uncover as well.
Do you have any other hypotheses if it isn't related to age or the dietitian?
It's really something that we need to explore a little bit more. Apart from that, I mean, it could be sort of influenced by nutrition organizations. We don't know whether even sort of industries that are kind of pushing more, animal-based protein quality. But I suppose as dietitians, we should be able to differentiate between the level of evidence and look at the published literature rather than industry influence. But I suppose it can sometimes come in that way where we actually do see some influence that industry has, even in terms of textbooks and nutrition guidelines. Unfortunately, that is the truth. Yeah, like a sort of subconscious influence. I can't remember where I heard this, but I remember hearing something about a dietitian journal, a bit like we've got in general practice, like the BJGP or something like that, having an ad for a healthy, balanced meal, and it had, like you said, animal protein in it. And whether it's those sorts of subconscious imagery that we are exposed to, whether, we're flicking through a magazine or something like that. But I don't know, that's just one theory. Yeah, that is interesting. The other thoughts I probably had was the fact that, during the training of the younger dietitians, maybe there is some level of influence that the senior dietitians have. But as I said, they all should be sort of grounded in an evidence base. So it really is, again, just a bit of a puzzle as to know why that is. And we need to maybe explore that a little bit more. So taking the whole picture on the education that dietitians have had, whether it's on micronutrients or on proteins and the completeness of it, and the fact that the RDs themselves said that they thought they'd had insufficient education on whole food plant-based diets, does that provide an opportunity for making a change in this area? I mean, how would you go back? And how do dietitians keep up to date on knowledge? How could we influence this? Yeah, I really feel that this is a key area. The fact that many dietitians feel they have insufficient education on whole food plant-based diets, it really presents, I believe, a sort of significant or unique opportunity for change. And I believe both within not only the university curricula and, ongoing professional development in already trained and professional dietitians. So my thoughts really on this and the evidence are kind of point to this is, continuous professional development training. There are initiatives out there aimed at improving, plant-based nutrition education. We have one here in the UK from Dr. Shireen Kassam, looking at the University of Winchester, who have a really fantastic and excellent course on training individuals for further knowledge on plant-based nutrition. And it really is amazing, and I would certainly recommend it. And obviously PBHP UK, have fantastic webinars, set up by Rahini Pajakel, as well as the fact sheets. There are a lot of resources out there. It's just, I suppose, tapping into that, and for dietitians to acknowledge and recognize that there are resources out there within the university level. There is a growing recognition, I suppose, of the need for, comprehensive education on plant-based nutrition. So, aside from our research, a study published in, Advances in Nutrition, I believe, they highlighted that medical and dietetics students often receive really minimal training and education on plant-based diets, despite their growing importance in public health and sustainability. So I know, staff from PBHP, the UK team, they really have made incredible efforts on, offering lectures and workshops. I know you have the student selective component that I know you yourself, Daisy, are involved in, which really seems fantastic, and trying to be an integral part of the initiative. In the workplace and the hospitals as well, it's another area that we really need to focus on as well. Hospitals and healthcare organizations, they're, I suppose, beginning to implement plant-based nutrition workshops. I know you have the Greener NHS initiative in the UK. They're trying to help push for more sustainable healthcare practices and promote plant-based diets, for its environmental benefits. Now, obviously, we have the Plant First Healthcare campaign aiming to implement more sustainable plant-based diets into hospitals. I suppose it's the default option, which I think, will really have its role and help, promoting plant-based diets in healthcare. And if dietitians actually start to see that, they may also help, their understanding on, plant-based diet nutrition. In Ireland, we do have the Irish Doctors for the Environment, who I've just become a member. They're also looking to bring this into the Irish model as well. Again, with the Greener by Default initiative, they're looking to see if we can implement those projects in the hospitals in Ireland, which is absolutely very much needed. And I was, I suppose, fortunate to present our research to the BDA Sustainability Group back in November. There seemed to be some really great interest amongst dietitians in all aspects of subspecialties working in healthcare and in the hospitals. So there was really important discussions that needed to have been had for them to understand on how we can best support dietitians really on their understanding of how to implement more sustainable diets within the hospital setting and in the healthcare setting. I understand there's a lot of concerns between the general public advice on, diet and nutrition compared to those that have, non-communicable diseases and they're more nutritionally vulnerable in the hospital setting. There could be a little bit more concern from dietitians around that. And this is probably why we had some responses where there was concern of them, dietitians having, concerns over an increased risk of malnutrition. So I suppose it's differentiating between the two as well, which is, quite different.
But don't you think even in that area, Michael, there's an element of misunderstanding? Because I've often heard dietitians talking about, fortifying food for people who are, like you say, at risk, and, adding saturated fat sources like butter or cheese. Well, there's plenty of unsaturated plant-based fats that are healthier and heart healthier. Surely, is that not another example of a sort of a lack of knowledge in this area, do you think?
Agreed. Yes, absolutely. We can absolutely supplement higher fortified foods using more plant-based foods. And it's something that I know, we want as in PBHP UK to even look at that and look at the sort of fact sheets around food fortification and supplements, which we can absolutely do to help improve, clinical outcomes, reduced risk of malnutrition, and help improve perhaps weight and weight profiles. And we can really do this on a plant-based diet. And, in my clinic, actually, there are some patients actually that follow a vegan diet. It's a little bit more rare, but, we do work with them on how to implement this using higher nutrient dense foods that are kind of plant-based. So it is very much done as well. And it is very achievable. It's just about them, coming away from that initial old model of animal-based food fortification practices. And it's something that our research actually did highlight, where we stratified for the different dietitians. So, we saw the whole cohort of dietitians' responses, but we did actually individualize them based on their subspecialty. So those that were working in pediatrics, weight management, diabetes, and oncology. And we did actually see a stark difference between oncology dietitians less likely to utilize plant-based diets in the clinical setting. We sort of hypothesized a little bit like what you were saying there, Daisy, that they're more likely, the patients, that cohort, are more likely to be malnourished. They need more, food fortification to help with sort of weight gain and cancer cachexia. Sort of, we did hypothesize that's why the oncology dietitians are not, utilizing these diets, because, they are naturally a little bit lower in calories, but we can absolutely try and fortify using kind of plant-based sources, and it is very much achievable.
This brings us on nicely to perhaps talking a little bit about your experience working within eating disorders clinics. Can you unpack some of the ideas around any link between eating disorders and plant-based diets?
Sure, yeah. I really feel this is becoming more and more of a relevant topic given the rise in the popularity of plant-based diets in general. And unfortunately, there is in parallel a synonymous increase in the rise and incidence of eating disorders. So, this is very much relevant. There does seem to be a great deal of concern amongst healthcare professionals and plant-based diets being too restrictive and leading to disordered eating patterns, and then ultimately a full-blown eating disorder such as anorexia nervosa or bulimia nervosa and binge eating disorder, to name just a few. This was also reflected in our paper, where a number of dietitians, around 30%, did feel there was a link between plant-based diets and potentially causing an eating disorder. So this was quite significant. It's something that we suppose need to explore a little bit more. The evidence may have partly come from a suite of papers back in the early 2000s, where they did see an association of individuals who followed a vegetarian dietary pattern, and they were more likely to experience eating disorder behaviors. But these studies were mostly association studies, so they're cross-sectional design, and they're really just looking at a kind of a snapshot in time. So you couldn't really tell which came first, either the eating disorder or essentially them adopting a plant-based diet. And as you know, that sort of mantra in research, correlation does not necessarily equal causation. So we wanted to see, and I looked to see if there was any, higher quality studies, things like prospective cohort studies that actually follow individuals over time. And there was a paper back in 2009 looking at adolescents who had, symptoms of eating disorders and adopting a vegetarian diet. And it really did look actually that the eating disorder was pre to them adopting a vegetarian diet. So the vegetarian diet actually came 1 year after the first symptoms of the eating disorder. And this would be sort of higher quality evidence as well. So we look back at this, and from this paper, actually, I believe that in the States, the Academy of Nutrition and Dietetics really concluded that there is not actually an increased risk of eating disorder behaviors in those following, a vegetarian or vegan diet. So that's really the gold standard advice. So we can kind of safely say that this is not a causal link. And if you look at some studies where they actually try to screen or assess individuals who followed a vegan or a vegetarian or plant-based diet, so we call it the Eating Disorder Examination Questionnaire, interestingly enough, they actually have lower scores, meaning that they're less likely to develop an eating disorder as well. So it's really, really interesting. And the BDA actually do have guidelines on this. So they have a document on the evidence on how to essentially follow a vegan or plant-based diet with an eating disorder. So it's very much achievable. There is still some concerns, but the evidence points to the fact that there really isn't association. So it really is a kind of a breath of fresh air to kind of really realize that, although we do appreciate that there's still concerns from healthcare professionals in that, and it's something that we do need to educate them.
What we're doing at Plant-Based Health Professionals is we're actively promoting a whole food plant-based diet as a really healthy diet. Quite recently, I came across this term orthorexia nervosa, and I wondered if there was any sort of conflict there, if you could maybe explain a little bit about the fact that obviously whole food plant-based diets, we do actually cite weight loss as one of the advantages of them. Yeah, maybe if you could say a little bit about what orthorexia actually is.
Yeah, it's an interesting one. Orthorexia really is, it's not necessarily a type of eating disorder, but it comes under the umbrella of disordered eating. And it really is a way of individuals trying to reflect the fact that there's kind of good foods and bad foods. But I suppose, again, there doesn't seem to be kind of a link with orthorexia and eating disorders, just like the other, eating disorders of anorexia nervosa. And then, as I said, the BD have such incredible guidelines on the fact that, those with eating disorders can follow a plant-based diet. And going back to the fact that naturally plant-based diets are lower in calories, and there could be a concern with sort of risk in, weight loss, particularly in the context of anorexia nervosa. But we do have those really robust guidelines on how to sort of fortify foods to make sure that there's adequate weight increase when those with experiencing anorexia nervosa or restrictive eating have kind of lower weights and need to have some weight gain as well. There is that concern, but again, we do have those really excellent guidelines to help manage these types of patients as well.
So you think that if somebody had a child with an eating disorder of the anorexia variety, they shouldn't necessarily be concerned that their treatment would be any worse because they wanted to continue with a vegan diet?
Yes, absolutely. And we really need to take into account that, following a vegan diet really is classed as a non-religious belief, and it is protected under, EU convention. I believe it's Article 9. So it is a human right. So we really need to be mindful of this and respect individuals' rights, particularly, young adults, teenagers who, desire to follow a vegan diet for particular reason of what it provides, ethics as well. There is a caveat that we need to really assess whether they really want to follow a vegan diet, or is it to do as a mask of way of kind of losing weight. And there are, I suppose, very specific eating disorder examination screening tools. And there is, I believe, an even updated one, particularly in the context of veganism and following a vegan diet, where we screen individuals on their willingness to follow a vegan diet and what are their reasons behind following a vegan diet. So we really do have that in the back of our arsenal or tools, just to distinguish between those patients as well. But yes, if a person wants to follow a vegan diet, obviously they can do with the right tools, but I suppose it has to be assessed both through the screening and also through their medical provider as well. And then we sort of have that conversation with the parents and make that kind of decision for them to follow it under the guise of the healthcare professional and supervision.
Right, that's really helpful. Thinking about all the work that you've got such a breadth of things that you've talked about today, but we'd love to know if you can disclose any plans of what your future research is going to be.
One of the key areas that we're really looking at is trying to make progress in this field. And I really believe it requires like a real collaboration, a coordinated effort between educators, researchers, policymakers, and dietetic organizations in order to really help implement and support dietitians in implementing plant-based diets into the hospitals. So I suppose within the UK, one of the key areas for improvement is perhaps revisiting or revising the national dietary guidelines to reflect more, sustainability and, really make it more explicit in their guidelines. There is an ongoing discussion about perhaps updating the British Dietetic Association Eat Well Guide to place greater emphasis on, plant-based foods. This would, I suppose, definitely be a crucial step in helping both dietitians and the public make more sustainable food choices. We really want to try and, shift that focus towards plant-based proteins, whole grains, and minimizing processed foods in the guidelines to help really align with, environmental and sort of health priorities. This is what our kind of future research is going to focus on, and really trying to understand, what dietitians within the UK really want as a real practical guide for implementing these plant-based dietary advice among healthcare professionals. We looked at the model in the US, where you have your My Plate model, also with the Canadian Food Guide. And it really is, a way of practical advice centered around trying to utilize more cultural foods, and they translate it into different kind of languages. So we want to see whether we can kind of model this, in the UK as well. And we're kind of looking to see if we can develop, another survey on surveying dietitians in the UK and what they actually want in terms of the updated Eat Well guidelines, and how we can kind of support them in adopting, more plant-based diets in the clinical setting as well. So that's sort of the future of our research as well, almost like a part two of our original one.
And I have to ask you, you've been working on a fact sheet, haven't you, for PBHP, and it's coming out soon, or it might have already come out once we're playing this episode. Can you tell us about that?
Sure. Yes, this was a really great collaboration with Rahini Bajegu, who really, spearheaded this. And we kind of wanted to see if we could come up with a particular fact sheet that is centered around a particular type of eating disorder, which is essentially binge eating disorder. It's one type, and it's really a serious type of eating disorder that affects 1 in 50 in the UK. It's around 1.25 million individuals suffer with an eating disorder, and binge eating disorder is actually the most prominent type of eating disorders, believe it or not. It's twice as prevalent compared to anorexia nervosa and bulimia nervosa combined. So we really wanted to try and develop a fact sheet centered around this, and I believe it will come out ahead of Eating Disorder Awareness Week, which is on the 24th of February. And it really kind of delves into the science behind how sort of a plant-based diet may help with the disordered eating aspect of binge eating disorder, and really understanding what are those kind of tips. We wanted to make it as practical as possible, and how a plant-based diet can really help nourish, the brain and the mind, particularly when, eating disorders are considered a type of mental health disorder as well. And there's some really good research. So we really looked at kind of tips for reducing, binge eating disorder episodes. We know binge eating disorder is really characterized by, I suppose, a loss of control of eating and sort of a rapid way of eating in a short period of time, followed by a lot of guilt and shame after eating, very large portions of food. This is a really serious medical condition. There's some, risks associated with this, particularly lifestyle chronic diseases like obesity, type 2 diabetes. There's very much increased risk as well. So we really wanted to make sure that we provide the best level of evidence on how to support individuals who perhaps are following a vegan or plant-based diet and that actually suffer from binge eating disorder, that there is absolute great evidence out there to help support them.
Yeah, you said that binge eating disorder was twice as prevalent as anorexia nervosa. So what sort of percentage of society are we looking at that might have a binge eating disorder?
Yeah, so it's around 1 in 50 in the UK that is essentially suffering from binge eating disorder, and it actually might be, I suppose, even more because of the stigma that's associated with it. And I suppose those that have binge eating disorder are, stigmatized, perhaps, being kind of overweight and obese. But actually, there's a lot of individuals with binge eating disorder that are not overweight or obese. This is one of those myths as well. So it could be even higher, and it really is quite a traumatizing condition, because it really leads to a lot of social isolation, a lot of guilt and a lot of shame. So we really wanted to, target these individuals and showing them there are some practical tips that can help, with their eating disorder as well, obviously in line with their medical health provider as well, as a kind of a practical tool.
That sounds really useful, particularly for GPs, because we get so little support with eating disorders. I think it'll be really useful for us to be able to access that as an information leaflet.
Yeah, I agree. We're looking forward to reading your work, Michael, and all the work that you're doing. Like Claire said earlier, it's such a breadth of important and really informative work. So thank you. We're really lucky to have you on the plant-based health professionals team, aren't we?
I feel very lucky to be part of it as well, and it's really great to be part of the team and the fantastic work that you guys are doing as well.
Well, we're coming to the end now. We're going to move on from shame around eating, and we're going to go straight into things that we're not ashamed of, which is talking with great passion about what we're having for dinner. So Michael, can you take the floor?
Well, I've been fortunate actually to have quite a few friends that are from different sort of backgrounds and ethnicities and cultures. One from, I suppose, Mauritius, from India, and a friend from Italy, none of which are vegan or plant-based yet. So that's sort of my mission in the next while, is to try and convince them. So I'm trying to develop certain recipes around these different types of foods. So tonight, I suppose, it will be for my Italian friends. So I'm trying to develop this recipe that sort of mimics that creamy Alfredo Italian pasta dish, attempting to try it this evening, and it would be sort of based on a sort of a soya-based cream sauce. So it's very simple, just putting a lot of ingredients in the blender and just pouring it over the pasta. I think the sort of secret that I found is utilizing or using truffle oil that really gives it that sort of cheese-based flavor. And I have to say it really does work, but I have to optimize that in order to convince him to go more plant-based as well. So
that's a great tip.
We'll see how it goes.
All I can say is that when you're cooking Italian food, as long as you don't mix your pasta, Apparently, that's something that's really
That's a real
offensive
faux
to an
pas,
Italian.
yeah.
If you run out of the fusilli and you think, I'm going to just top this up with some penne. I'm not sure if I've
Oh
done
my
enough
goodness,
pasta.
no, it's almost
That's the
sacrilegious.
worst. Yeah.
I didn't know that. I thought it was pineapple on pizza that the
Oh,
Italians
that's
didn't
another
agree.
one as well. Yeah, that's an absolute
Or
no-no as
cheese
well.
and fish on pizza.
Oh,
But anyway, you
Yeah,
won't be doing that. You won't be making that
no,
mistake.
absolutely not. That's one benefit.
Are you using like silken tofu, Michael? You mentioned it's a soya-based sauce.
Yeah, it's kind of a softer silken tofu, and I think it was also truffle oil. I think it really gives that creamy texture and that kind of cheesy texture with nutritional yeast and maybe some sort of sautéed garlic as well. But it does seem to, I have to say, it does seem to work. I might have to write down the recipe if it's going to convince him. I think that's where I have to get to.
Well, good luck with it tonight.
Thank
Claire,
you.
what about you? What are you having for dinner?
Well, I'm really lucky because I don't need to cook tonight because I'm still going through an enormous cottage pie that I made mostly from the ingredients from my veg box this week. And I'm turning into a young person, I think, because I've doubled my protein and it's with the base, it's got loads of veg in it. So it's got carrots and a bit of parsnip and onions and garlic and leek and all of that, and can of tomatoes. And then I've got both green lentils and here's one for you, Daisy. I know you don't call them soya chunks, you call them soya curls, don't you? But it's full of soya chunks as well. And then
Nice.
a lovely crushed potato topping with some cauliflower in there as well to sort of make a mash. It's enormous and it is so delicious. And I'll serve that with I've got Savoy cabbage left over and the other thing that came in the veg box, which was really lovely, was kalettes, those sort of mini kale plants.
No, I've never seen those before.
Oh, yeah, they're really good. I think they're full of polyphenols with their sort of purplish colour and everything. They're really, tasty little things. It's like a cross between a sprout and a cabbagey thing.
Wow.
Have you seen them, Michael? I'm not imagining
actually,
them, am I?
Yeah, that sounds very interesting. Wow.
That's
Sounds
unique,
like a powerhouse,
Claire.
Yeah.
Well, anyway, on to you, Daisy.
I don't want to say mine now after that. Mine's going to sound really unhealthy in comparison to kalettes. Blimey.
Kalettes.
Well, it's Friday night and I really fancied pizza, so I try and do like a healthier version of pizza. And we buy these ready-made bases. They're actually quite nice. And then you can sort of do whatever topping you want. So I'll have lots of different veggies on there. But hear me out on this. I've now recently found, instead of plant-based cheese, or sometimes I used to make my own plant-based cheese, but I actually dollop hummus. So basically you've got tomato base, lots of veggies, and then dollop hummus at the end, and it's creamy and delicious. So that's my new take on healthy pizza.
Oh, wow.
So yeah, that's what we're having tonight.
I'm thinking, wow, I'm not actually going, oh, that sounds delicious, because I think I'm not quite convinced by the hummus on pizza. But I'm sure you'll serve it to me at some point, and I'll have to get into it.
I can imagine it. People were probably thinking, what is she on about? But it's really good. So try it next time.
Just thinking of my Italian friend, how he would feel about that, but you never know.
No, don't serve it to your Italian friend. I would not recommend that. Oh, Michael. Oh, well, look, thank you so very much for your time, Michael. It's really, we were really looking forward to this, and I'm sure the listeners will really enjoy listening to it as well. Thank you for all your work and for taking the time to tell us all about it today. We really enjoyed it.
No, it's been a real pleasure. Thank you for having me on.